The relationship between UK and Kuwait goes back many years ago. In fact, it goes before the discovery of the oil in Kuwait.
They have recently set up a UK-British Council, which is made up of a number of the leaders of industry and commerce within the UK and Kuwait.
So we have relationship with a number of institutions in UK. We work with the UCL, Oxford, Cambridge. One of the examples is what we do with the University of Dundee.
What we've weaved together is what I think is quite a unique package internationally, which combines education with research, as well as clinical service development and the definition of clinical standards.
15 clinical standards for diabetes management were established. 10 of them were adopted from the Scottish standards, Dasman. The standards have received the government endorsement in 2011.
In Dasman, the Clinical Skills Center is one of the department actually, and the center that actually provide education and training to not only patient and doctor, the healthcare provider, but also private companies and the public. And we actually have some of our people go to University of Dundee to get this training and come back to actually have this relationship of higher education and collaboration between the two, I would say, university and center and our organization.
Collaboration with internationally well-known universities and the centers not only will support us in reaching all goals faster, also will support us in reaching all goals in the higher rate of success.
Over the years, set up various enterprises with the Dasman Diabetes Institute, linking this with Oxford.
With the more than 30 years experience in this field, Octam is a center with a huge experience in this field.
Goals are essentially to help the Dasman Diabetes Institute become one of the best places in the world in terms of its research and in terms of its clinical care.
In this period, we dealt with the diabetes, its complications, and trying to work a lot of research in order to understand how we need to make the difference in the health of the people in Kuwait.
In 2010, the Kuwait Wellbeing Study was initiated as a collaboration between the Dasman Diabetes Institute and the University of Cambridge. The purpose of the study is to raise public awareness and to shed light on the etiology of diabetes and obesity in the Kuwaiti population, which will lead to prevention in the future.
We had the need to do a collaboration with UCL. First of all, to have a current objective and having a harmonization between the local genomics data and the international genomics data.
Since 2011, we've been in a close partnership with the Dasman Diabetes Institute to assist them in developing a state-of-the-art genome center. It's incredibly important for the region, especially for Kuwait. It reveals some of the background genetics on which certain diseases might arise. And so this is one of the key objectives of our work with Dasman.
Bottom line is that physicians and patients need the info for prediction, diagnosis, and intervention.
And I'm pleased to say that and various other achievements that Dr. Kassim has been associated with and has achieved, he was recently honoured by the Queen with the Order of the British Empire, which is a highly significant award, not only for himself, but also reflects highly on the Dasman Diabetes Institute as part of our joint programmes.
And I'm very happy with this because it opens the door for what we can do together, and we learn from each other as we learn in different institutions in this world.